We're still waiting for the government to decide whether kids should get the COVID vaccine. 16 to 17-year-olds and younger children with underlying health conditions are being vaccinated, but not otherwise healthy 12 to 15-year-olds. It's expected that cases will rise as children return to the classroom. Infection rates in teenagers are already higher. Here we can see the highest infection rate is currently between 15 and 24-year-olds. High infection rates are an argument for the vaccination, but the health risks of COVID are low for young people. Recent data for England shows the risk of death for under 18s is 2 per 1 million children. And the chances of someone under 18 being admitted to intensive care is around 1 in 50,000. But scientists are concerned about the long-term impact of COVID. Latest published research suggests up to 1 in 7 children who have COVID may have symptoms linked to the virus some 15 weeks later. The JCVI, who make the decision on the rollout, have to consider the risk of COVID outweighing the risk of the vaccine. The medicines regulator has already given the green light for the Pfizer and Moderna jabs for those aged 12 and over. And other countries such as France, Spain and the USA are already administering the jab to young people. We understand the JCVI is still waiting to consider more data, but are they moving too slow?
Here we have to throw everything we know at it, not just the hard facts of what we know for absolute certain. We need to take a judgment on what we don't know for certain, but can guess at. And I think they're being more cautious about the side effects of vaccination than they are about the long-term sequelae of the disease.
And the vaccine for children is not the only big decision the JCVI has to take. The government is still waiting to learn if it should begin its autumn booster campaigns. Other countries have started administering third jabs after fears of waning antibodies. Let's look at Israel. It's seeing a surge in cases due to the Delta variant. For 45 days, the number of severely ill hospitalized patients doubled every 10 days. That's this yellow line. And here it was projected to reach. But 2 weeks after the third dose campaign started, that's this dotted line through the middle, this exponential growth slowed. And you can see this on the dark line, the number of actual severely ill patients in hospital right now. The government says it is ready to begin both campaigns, vaccinating children and the booster. It says it has enough stock of the vaccines, but it needs the JCVI recommendation. The panel says it won't make that call until it has all the data.